You're welcome to another Toothy Tuesday. So this week, we're going to talk about how bad breath actually comes about. So as we established in our previous session, bad breath arises from the mouth in about 90% of cases. But in some other cases, it could be from the throat or the respiratory tract or even the digestive tract. So we all have bacteria in our mouths, which is very normal. That is an established fact. And in fact, we even need them for different purposes such as digestion and even fighting other diseases. But there's a group of these bacteria which break down food substances remaining in our mouth after we eat. And just as humans produce waste after we eat, these bacteria also produce waste but in the form of gases. And these are called volatile sulfur compounds. And these volatile sulfur compounds have a very foul smell. So this is what is actually perceived on the outside as bad breath when the person opens their mouth. So there are certain factors which make it easier for these bacteria to hide in the mouth, such as poor oral hygiene, cavities in your teeth, infections in your mouth, and then old fillings with rugged edges. These usually trap food and make them a storehouse for these bacteria. So also, if you're not brushing your teeth with a toothpaste that has the right antibacterial components that will combat these bacteria, it makes your job twice as hard. So most of the bacteria that cause bad breath also hide in the back of our tongues. And the back of our tongue is actually designed in a way that it has deep grooves and crevices, which make it a very convenient hiding place and storehouse for these bacteria. So that's why it's very important to brush the back of your tongue whenever you're brushing your teeth. And studies have shown that tongue brushing reduces bad breath measurements by up to 70%, and that's a lot. So another way is also that scrape your tongue with a tongue scraper, which we've discussed in previous sessions. Also, when we brush our teeth, we miss cleaning about 30% of the tooth surface because your toothbrush bristles can't fit in between the spaces between the teeth to clean them. This is why flossing is a very important part of your oral hygiene routine. It gets rid of the plaque that is stuck in between the tooth surfaces, which can be a storehouse for bacteria. Likewise, food particles like meat and other foods could get stuck in between your teeth, and then they are decomposed by these odor-causing bacteria, and then they produce offensive smells. Another cause of bad breath is dry mouth. Our saliva actually washes our mouth constantly. So if you don't have enough saliva in your mouth, it means your mouth is not getting cleaned enough. And this dry mouth could be caused by some medications or simply by just breathing through your mouth, which dries your mouth. So if this is the case, chewing sugar-free gums and mints can actually help to stimulate saliva flow. Or your dentist could also prescribe artificial saliva. It's also important to take very frequent sips of water. This helps to refresh your mouth. Gum diseases. So gum diseases can actually lead to bad breath, which is why it's very important to visit your dentist at least twice in a year, even if you don't have any complaints, because these gum diseases form a pocket between the tooth and then the gum. And this is a very convenient storehouse for these odor-producing bacteria. And your dentist can detect this and take you through the right treatment to get rid of this gum disease if it's detected on time. We said 90% of bad breath comes from the mouth. So in 10% of cases, the source of bad breath is actually not from the mouth. Let's discuss these extraoral causes of bad breath next week on Toothy Tuesday. But please let me know if you have any questions and I'll be glad to answer them. Thank you. Bye.